Hi, welcome back. So this is the 6th video in our September series on functional behavior assessment and functions of behavior. And so once you've done that data collection and you've completed your assessment, then you're going to sit down and you're going to write a hypothesis statement. This is a very brief statement and it is not emotional. So that's one of the things that behavior analysts are known for and behaviorism is known for, is kind of removing that emotion. It's not that it's not important, because like I said, my daughter was anxious or worried or fearful of the dog in the laundry room. However, the function of her behavior was to escape a non-preferred task, to escape the task. And so my treatment was not based on anxiety, but my treatment was based on the function of behavior. And so when you're looking at your functional behavior assessment in that circumstance, and that's in our first video for this series if you want more information on that, the statement would be, when presented with a non-preferred task of putting her clothes in the washing machine, Anna Lee engages in crying, screaming, sitting on the floor, holding onto my leg, and verbal refusal in order to escape a task demand, escape the task demand. And so you state what elicited the behavior, what was the antecedent, what was the behavior, and what was the function. Okay, so what's the trigger, what's the antecedent, what's the eliciting factor, what is the behavior, and what is that function. You don't want to apply emotion to this, so you don't want to say when anxious engages in a fit in order to avoid anxiety-provoking situations. That would not be an appropriate statement, okay? So you keep it to the facts, you keep it to the observable. I can't observe anxious. I don't know when she's anxious. I don't know if she was anxious, if she was sad, or if she was mad, or a combination of the three. I can't observe that. But what I can say is when I tell her to put her clothes in the washing machine, she loses her mind in order to not have to do it. And so you can think about this in the school situation as well. Immediately before lunch, Mark engages in a tantrum in order to escape going to the lunchroom. So in this situation, perhaps Mark was being bullied. Perhaps Mark was being socially isolated, or perhaps Mark just has poor social skills. I don't know which one of those factors is really influencing, or if it's a combination of the three factors, because somebody who doesn't want to go to lunch, it's probably a combination of all three: poor social skills, a lot of social demands, and maybe some loud environment, a lot of different things. So there could be many factors that are going into why a student doesn't want to go to lunch. During non-preferred tasks in the classroom, Mark will engage in a tantrum behavior in order to escape having to complete a non-preferred task. So in this situation, maybe Mark's throwing a fit, destroying the classroom, ripping up his paper, verbally stating no in order to get out of having to do a task. And so a non-preferred task, a difficult task, a writing task, a math task, I don't know what task, you would state the non-preferred task is presented. Mark engages in aggressive behavior, tantrum behavior in order to escape doing that task. So there's a lot of variables that could be going into this, but now our intervention is more targeted. I know exactly what we're going to do. So we're going to talk about our replacement behaviors in our last video for this series, but our replacement behavior is going to specifically target a more appropriate way to teach Mark that same how to overcome or to compensate for that weakness, so that we have a more appropriate way of accessing that same function. And so those are things that you want to do. You want to also define your behavior. So once you have those, you've completed that interview, you've looked at those logs, and you've done that observation, you want to define your behavior. So maybe your behavior is tantrum behavior. So Mark engages in tantrum behavior. Well, what exactly is tantrum behavior? What does that look like? And so that's where you're going to say tantrum behavior, which includes laying on the ground, crying, screaming, throwing objects, because everybody's tantrum looks a little bit different. Some kids will hit other people during their tantrum. Some kids will just stove up and refuse to do anything. Some kids during a tantrum will write no on their paper. If you say write your name, they write no. And you're like, oh my gosh. Or do they knock their pencil off of their desk, just kind of push it to the side until it falls off? What does it look like for them? And so it's really important, once you have all of that data, or all of that information from your interviews, your logs, and your observations, to sit down and define out what is the behavior. Is it non-compliance? So non-compliance is a general term for just not listening. And so that could be verbal refusal for some kids. It could be just sitting down for some kids. It could be, like I said, that writing the no on the paper. So you sit down and you define, what does it look like? So those are the things that you are going to do with your behavior data. And our next video and our last video, we'll talk about collecting data on our behaviors and selecting a replacement behavior.